Hello and welcome to NewMouth's podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go. Welcome to NewMouth's podcast. Today, we're diving into the world of dental health with a special emphasis on how smoking affects your mouth. Joining us is Jake, an expert on oral health. Jake, it's great to have you here.
Thanks for having me, Sarah. I'm excited to discuss this important topic.
Let's start with a broad overview. What exactly does smoking do to your mouth?
Smoking impacts almost every part of your oral cavity. It can lead to tooth decay, gum recession, bad breath, and stained teeth. More severe issues include bone loss in the jaw, black hairy tongue, inflamed salivary glands, and a higher risk of periodontal disease and oral cancer.
Wow, that's a lot. Can you paint a picture for our listeners of what a smoker's mouth typically looks like?
Sure. A smoker's mouth often has visible signs like darkened or stained teeth and gums, persistent bad breath, and a rough texture on the tongue. Over time, there can be more severe conditions like gum recession, where the gums pull away from the teeth, and discoloration of the gums, known as smoker's melanosis.
Speaking of smoker's melanosis, can you explain more about it?
Absolutely. Smoker's melanosis is the darkening of the gums and sometimes the lips and the roof of the mouth due to smoking. It's not dangerous, but is a sign of tissue changes caused by tobacco use.
Is there any hope for recovery if someone quits smoking? Can their gums return to normal?
It depends on the extent of the damage. For conditions like smoker's melanosis, the gums often return to their normal color within 6 to 36 months after quitting. If gum disease is present, the gums can heal if the disease is caught early. However, significant damage like bone loss may be irreversible.
So, smoking is the most significant risk factor for gum disease. Can you talk about what gum disease looks like in smokers?
Definitely. While gum disease in smokers includes redness, swelling, and bleeding of the gums, these symptoms can be masked because nicotine reduces blood flow. This makes it harder to detect and can lead to more advanced disease stages without noticeable symptoms.
How is gum disease treated, especially in smokers?
For early-stage gum disease, good oral hygiene and regular cleanings can help. More advanced cases might require deep cleaning below the gum line, medication, surgery, or even bone grafting. The success of these treatments dramatically improves if the patient quits smoking.
What about the risks of oral cancer for smokers?
Smokers have a significantly higher risk of developing oral cancer. This includes cancer of the mouth, throat, esophagus, and lungs. Different tobacco products like cigarettes, cigars, and chewing tobacco all carry these risks.
For someone who smokes and wants to improve their oral health, where should they begin?
The first step is to quit smoking. This will reduce the risk of gum disease, oral cancer, and other health problems. Alongside this, maintaining a rigorous oral hygiene routine is crucial. Regularly brushing, flossing, cleaning the tongue, and visiting the dentist for professional cleanings.
Can you share some specific oral hygiene tips for smokers?
Of course. Smokers should brush their teeth at least twice a day, use floss or a water flosser daily, clean their tongue with a scraper, and rinse with an antimicrobial mouthwash. Regular dental visits are essential, and any irregularities should prompt an immediate visit to the dentist.
This has been really enlightening, Jake. Before we wrap up, any final thoughts for our listeners?
Just a reminder that it's never too late to quit smoking. Your oral health will benefit immensely, not to mention the improvements to your overall health. Taking that first step can make a significant difference.
Thank you so much, Jake, for sharing your insights with us today. To our listeners, don't forget the importance of maintaining good oral hygiene. This is NewMouth's podcast, and we'll catch you next time. That's all for today on NewMouth's podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.